Thank you for connecting to today's Commonwealth Healthcare Network Fund informational conference call series. This program is being archived, recorded, in order that you'll be able to watch it on the website, and this is also taking the place of our August 13, 2013 program, which will air at 3:30 Eastern, 2:30 Central Time. These sessions are intended to inform nonprofit healthcare facilities about the Universal Services Healthcare Fund, about the Commonwealth Healthcare Network Fund, and to answer any questions that you may have regarding this project. A couple housekeeping rules that we would have for you. First of all, if you would please, pull the presentation that is available at www.chnf.ky.gov, and you'll be able to get the slides that we'll be reviewing today. Also, we would like to have a record of anybody that participates in this program either on August 13th or on online. And so if you would please, whether you participate on the 13th or whether you watch this online, please send an email to chnf@ky.gov. And simply in the subject line of the email, you can either put watched first or watched August 13th program, or simply in the subject line, just say watched archived program, just so that we know that you participated. I appreciate you tuning in today. My name is Rob Sprang. I'm the director of Kentucky Telecare. I'm also the chair of the Kentucky Telehealth Network Board of Directors. And co-hosting with us is Brian Kaiser, who is the executive director of the Office of Broadband Outreach and Development. Just to give you a brief history of why this program is important. Of course, in the 1990s, electronic health services really began to pick up, whether it was electronic health records, telemedicine, teleradiology, but those technologies really began to elevate themselves into the 1990s. One of the great problems was that broadband services required to run those programs was terribly expensive. And so the Universal Services Fund was established in 1997. It was mandated by the Telecommunication Act of 1996. Purpose was to lessen the burden of broadband service costs for rural and nonprofit healthcare providers. The program was never really fulfilled its full impact on healthcare providers. The program was originally authorized to be able to spend up to $400 million a year, and actually it never spent more than $85 million a year. And so one of the iterations of this program, in order to expand it, is called the Healthcare Connect Fund, and it is expected to expand to rural healthcare providers as well as some urban providers, data centers, and administrative offices. Healthcare facilities must embrace technology. Electronic health record systems are mandatory. And while at one time it was an item that was nice to have, if you're going to participate in government payer programs, you have to have an electronic health record system. Telehealth technology can help bring access to specialty services into community-based provider facilities. A robust community-based healthcare system is critical to economic development. In many communities, small communities around the country, the hospital in the area is, if not the largest employer, the second largest employer. And so it's imperative on us that we make an effort to support our community-based healthcare providers. Kentucky has developed the Commonwealth Healthcare Network Fund within the Commonwealth Office of Broadband Outreach and Development. We've created a website with information that I hope you take time to look at, www.chnf.ky.gov. The Commonwealth Healthcare Network Fund Administrative Agency is intended, and our roles for the next few months are to be to gather letters of interest from people that are interested in being a part of this program. And once we get those letters, we're going to organize these participants to unify the project. we will then follow up with letters of agency, which are binding letters from the participating programs that give CHNF the right to apply on your behalf for this program, and then finally we'll apply for the subsidy and administer the program. In the past, broadband costs were high, and the high cost did not incentivize the development of e-health technologies. And so, for one reason or another, whether it was the cost of broadband or just the issue of adopting new electronic health record systems, it was rather slow, and rural providers did not adopt quickly. The early USAC programs had some success, but they never achieved the real benefits to community health providers that they were expected to. To talk a little bit about the service that we're working on today, the Commonwealth Health Network Fund, there will be a 65% subsidy for broadband services. And that's all broadband services, but there are some expansions to that. It will also cover required equipment. So if you have a broadband connection that terminates into your healthcare facility and it terminates on a large router, then either the cost of that router, if you haven't purchased it yet, or the annual maintenance of that router would be subsidized by 65%. And the program is for not-for-profit rural healthcare providers. Now, what we're talking about today is the development of a consortium application within Kentucky. And a consortium offers several benefits. One, it allows the potential to bring in urban healthcare facilities. It'll also allow us to connect administrative offices that serve healthcare facilities, as well as data centers that serve healthcare facilities. All of these will fall under the 65% subsidy. Now, the program requirements are that urban sites must be less than 50% of the aggregate number of facilities in the application. So there must be a preponderance of rural facilities. We also have the opportunity to have Kentucky have an approved master services agreement. And the advantage to this is it will bypass a very cumbersome competitive bidding process that is required of most programs. It could save a lot of time, a lot of effort. We are also pursuing what is referred to as an evergreen contract, which means that we will only have to apply for the services once every 3 years. Again, it will take a tremendous administrative burden off of everybody. This program allows for a single application to include many sites. So if you are an administrative organization with several healthcare facilities where you have an equity relationship with them, then you can simply apply as a clinic system or a hospital system and list all of your facilities under that system. And as we said earlier, there may be the opportunity for equipment and possibly upfront construction cost for owned facilities, if that is more cost effective than leasing from the provider. So if you're in a community where you have a real difficult time getting broadband services, they're just not available, maybe especially to the level that you would like. If you can prove that customer-owned equipment and customer-owned construction is a better solution than purchasing from the local providers, then you have an opportunity to get 65% subsidy for those purchased or owned facilities and constructed facilities on your own. The application for the Kentucky Consortium should be in late summer or fall of this year, and funding will begin on January 1 of 2014. In order for you to participate, we must have you complete a letter of interest form and return it by close of business on August 9th. It's my understanding now that we're going to push that date out about a week, but we do need people to fill out the letter of interest form as soon as possible. It requires a name, address, county, and type of facility for each one of the healthcare facilities that you want considered. We need a primary contact name and email address, and then we need an authorized signature from your organization. Now, once we gather all of those letters of interest, we will determine eligibility. And once we do that, there will be a binding letter of agency that will be required from every group. Additional information but required will be, we need to know what your current broadband information is, what size of the pipe, what kind of connectivity you have. Then we also want you to take the opportunity to look at what would be our desired broadband connectivity. Would we like to expand connectivity given that we'll receive this 65% subsidy? And so what we'd like you to do is an exercise, what would heaven look like if we had this 65% subsidy? How big of a communication broadband pipeline would you like? And then we need your current broadband provider name, including account and circuit information and other information that will be determined at a later time. Now, in order to continue your participation in the program, you're going to have to pay the 35% of your broadband cost, as well as an administrative fee of 6 to 9% of the savings to the Commonwealth Health Network Fund. And that 6 to 9% is going to pay for gathering the data, applying for the program, and ongoing administration of the program. And we think this is very competitive. There are consulting firms around the country that charge 20, 30, even 40% of savings. We believe if we can spread these costs off across enough healthcare providers, that we believe we can get the administrative fee in a very reasonable 6 to 9% of the savings. So the target participants for our consortium are nonprofit hospitals, nonprofit clinics, public health departments, community mental health centers, nonprofit psychiatric hospitals, post-secondary educational institutions, teaching hospitals and medical schools, and then data centers and administrative offices that serve healthcare facilities, which traditionally have not been applicable under universal services subsidies. There is one caveat: large urban nonprofit hospitals that are over 400 beds. Their support is capped at either $30,000 a year or no more than $70,000 over a course of 5 years. Now you can get this PowerPoint presentation at www.chnf.ky.gov, which is our main website, but there are also many other information links there. There's a Kentucky Frequently Asked Questions link, very specific to Kentucky, but at the bottom of that link are other links that go to the National Universal Services website and Healthcare Connect Fund links. There is a case study of one hospital's potential savings. If you really don't understand how this will impact you, I'd suggest you look at the case study. It provides a really compelling reason why you should consider applying in our consortium. And then, of course, there's a letter of interest to participate in the program. And while we show that we would like that returned by August 9th, we believe we're going to push that date out at least a week. So what we want you to do is just follow the instructions and get that letter of interest applied just as soon as possible. And then, of course, you may submit any questions you have to the Commonwealth Healthcare Network Fund at CHNF at ky.gov. I think we'll open it up now for questions. If you are participating in the live program, which is on Tuesday, then we will have people there to answer the questions, but you can also submit questions to CHNF at ky.gov. So I appreciate everybody participating in the program today, and we'll see you soon. Thank you.